Parkinson's disease was first recorded in Britain by an apothecary named James Parkinson in 1817, though it was not called Parkinson's disease until 1881. Parkinson's disease can be traced back to ancient Egypt and the Bible, with people experiencing similar symptoms. Old treatments included remedies made from mucuna, which contained high levels of L-dopa that is still a remedy today. In the early 1900s, scientists began to investigate what caused the disease. Parkinson's affects the brain. It wasn't until Arvid Carlsson, who figured out Parkinson's was caused by the neurotransmitter dopamine, that we began to understand how Parkinson's works. Carlsson won a Nobel Prize for his work. Parkinson's disease is progressive over time. 4 symptoms are commonly linked with the disease. They are tremors, rigidity, slowness of movement, and in the later stages, Parkinson's causes the loss of balance, which leads to injury. If left untreated, many people with Parkinson's are unable to walk in about 8 years and are bedridden in 10. The average life expectancy is shorter than a person without Parkinson's disease, and the people with Parkinson's have double the mortality rate. Life expectancy is shortened due to injury from falls and infectious pneumonia contracted by the bedridden. Parkinson's disease is a central nervous system disorder. It is caused when not enough dopamine formation and action is being produced in the dopaminergic neurons of the brain. Parkinson's disease is characterized by the accumulation of alpha-synuclein protein forming Lewy bodies. This is the fMRI from before. It shows the brains of 2 people who have Parkinson's disease. The top shows normal brain activity, and the bottom 4 show Parkinson's activity in the basal ganglia. The middle 2 show a brain pre-medication, and the last 2 show a Parkinson's brain after the medication was administered. But what is happening to the brain to cause Parkinson's? Well, in the midbrain area where the basal ganglia is, dopaminergic neurons known as the substantia nigra pars compactus die off. This causes too little dopamine, which leads to Parkinson's. Fortunately, there are ways to treat Parkinson's disease. There is no cure for Parkinson's disease. To manage the disease, certain drugs can be taken. Drugs taken include levodopa, which is turned into dopamine by dopa decarboxylase. Since only a small amount of dopamine is absorbed where it is supposed to, this drug can have many side effects. Carbidopa can prevent the metabolism of L-dopa before it reaches the dopaminergic neurons. This drug carries fewer side effects than levodopa. And MAO-B inhibitors, which increase the level of dopamine in the basal ganglia through blocking metabolism. Side effects of Parkinson's disease medications include headaches, fluctuating emotions, dizziness, and low blood pressure. Carbidopa and levodopa are frequently given together in a drug known as Sinemet. They are given together because carbidopa acts as a precursor to levodopa, allowing it to get into the brain and be administered at a lower dose, since the carbidopa paves the way for the levodopa. Other treatments include deep brain stimulation, which sends electrical impulses to specific parts of the brain, rehabilitation to promote motor functions and balance, or speech therapy. A diet high in fiber and full of water is also recommended. In addition to these treatments, surgical treatments are being developed. Scientists have developed a procedure which implants fetal brain tissue into Parkinson's patients, which has had limited success. Still, due to the nature of the tissue cells used, the procedure is highly controversial. It is important to spread awareness about Parkinson's disease. Everyone can make a difference.